Bismillahirrahmanirrahim ji, a very easy question here. Let's see what we got here. What is the most likely underlying cause? So they are basically asking the diagnosis. The options we have is trigeminal neuralgia, Sjogren syndrome, giant cell arteritis, obstructing salivary gland stone, and TMJ dysfunction. Let's read the statement now. A 58-year-old man. Okay, that's a big hint here. I'm gonna tell you why. 3 episodes of painful swelling beneath the lower jaw over the past year. Okay, there is something which is recurrent and which is painful as well. Okay, the pain become worse during meals. Okay, the meals make it worse and resolves after antibiotic treatment, but repeatedly returns. Okay, so what I want you to focus in this statement is there is a condition that's actually occurring in an elderly patient who is having recurrence of symptoms and a painful swelling. Okay, painful swelling here. And secondly, the pain become worse during meals. So whenever you eat something, it makes it worse, and it resolves after antibiotic treatment. This is something that I need you to focus. It resolves after antibiotic treatment. Whenever the stem gives you a treatment, and in the stem, they're basically handing you the diagnosis. Okay, so let's see. Option A, trigeminal neuralgia. So what happens in trigeminal neuralgia? I don't see anything that's matching trigeminal neuralgia here. Trigeminal neuralgia is a condition in which even mild touching of the face, even the air causes the pain. Although eating also causes the pain, but the trigeminal neuralgia presents with very obvious findings, and one of them is mild chewing, brushing the teeth, anything. And secondly, I don't see anything here, and secondly, it does not resolve after antibiotic treatment, and it is not recurrent. This rules it out very easily. It is not trigeminal neuralgia. Secondly, we have the Sjogren syndrome. Okay, for Sjogren, you have to remember one word, and that is dryness. Sjogren is something in which you are gonna see dry eyes, you're gonna see swelling of the parotids, but that's painless swelling. That is painless swelling. Here I'm seeing a word called painful. So that's the biggest red flag to rule out Sjogren's. But secondly, Sjogren is something which is also associated with dry eyes, xerostomia. They will not give you a Sjogren syndrome with a 3-line vignette, and it never resolves after antibiotic treatment. It never resolves after antibiotic treatment. I told you, this is the biggest hint. You have to keep this in your mind. It never resolves after antibiotic treatment. That rules it out. Sjogren syndrome. Okay, why am I ruling this out? Because I'm not seeing dry eyes. I'm not seeing painless swelling. I'm not seeing xerostomia. What I'm seeing is anything that's worsening during meals and resolving after antibiotic treatment, and a painful swelling as well. It does not cause a painful swelling, although it causes lymphocytic enlargement, which causes painless swelling. I told you, it's not painful, it's painless, which rules it out. So these options, both of them are gone. Now we have the GCA, giant cell arteritis. Okay, for GCA you have to know one thing. It never occurs in a patient who is below 50. So this patient is the perfect candidate for GCA. Okay. Secondly, for GCA, there are some things that you have to remember in your for your exams, and that is GCA is associated with vision symptoms. It is associated with increased ESR. I'm not seeing any ESR elevation here. I'm not seeing anything that actually points to GCA, because GCA is something which is immune mediated, okay? And why would it resolve with antibiotics? That's the biggest clue here. I told you, this is something, just keep it in your head. GCA never resolves with antibiotics. GCA resolves with steroids, okay? GCA resolves with steroids. Okay, I have the perfect age here, but I'm not seeing other findings. For step 2 CK, you have to remember the patterns. You cannot go after one word. You have to remember the patterns. And this pattern is not for GCA. This pattern is not. You don't see a painful swelling. You don't see a painful swelling in GCA. There is no swelling. Also, it does not resolve with antibiotic treatment, although it worsens during meals. But the reason is something else. It worsens during meals due to ischemia of the external carotid artery branches. It does not worsen during meal due to the reason I'll be mentioning for this MCQ. That makes it a wrong answer. GCA is the wrong answer here. And we have a brother of GCA called the TMJ. For TMJ, you have to remember it causes popping or clicking of this joint, the TMJ joint, okay? Popping or clicking of this joint. And also it occurs in people less than 50, almost less than 50. So the age factor, the presence of a painful swelling, it does not cause a painful swelling, and resolving with antibiotic treatment also rules this option as well. So here I am left with only one option, that is obstructing salivary gland stone. That is the correct answer here, my friends. This is the correct answer. Now, why is this the correct answer? If you have a stone here that's actually obstructing the duct, this is, for example, I would say a submandibular gland. This is a submandibular gland, okay? It constantly produces some secretions, but there are stones present here. If the stones are present, it's going to cause inflammation because this will not be passing. If this is not passing, the saliva is not passing, and whenever you eat some meal, you have more salivary production. The more the saliva production, the more the blockage. It gets more engorged and it causes pain. This is what you see as a painful swelling, okay? Everything is now aligning slowly and gradually. It causes a painful swelling. And what is the most important gland that's involved in the formation of stones? That is submandibular gland. Actually, we have two reasons. The first one is that it's against the gravity. So if it's against the gravity, the movement would be slow and there will be more formation of stasis. And secondly, it has a high mucin content. If it has a high mucin content, of course, viscosity increases, which increases the chances of stone formation. So what is the gland that actually increases the formation of stones? That is submandibular gland. That is not parotid gland, okay? So here I am with the answer, and that is obstructing salivary gland stone. And secondly, the antibiotic statement here. The antibiotic statement here, I know I love this word here because it actually solves everything. You can solve this question in 30 seconds if you actually know what's happening around here. Because antibiotics does not remove the stone. They remove the inflammation, okay? They remove the inflammation. They do not remove the stone. They remove this portion here, the inflammation. So it becomes very clean. It becomes very clean and the patient goes home. But after some time, he comes again because the stone was there and the inflammation occurred again. Okay, so antibiotics will resolve his symptoms. They may even reduce that swelling as well, this swelling. But of course, there is a locked door. So wherever there is a locked door, of course, you're going to see inflammation behind that. So that makes it the correct answer.